All right. Good morning, everyone. I am Carrie Harrington. I'm the director at the Nevada Cancer Coalition. I'll be kicking off today's All Coalition Partner Meeting. Let Kristen get those up. Fantastic. So we do have a few housekeeping items. Hopefully everyone has a restroom down the hall as we do here. So first off, everyone is muted for the time being. If you do have questions, please go ahead and ask them. You can ask questions and make comments along the way. You can locate the Q&A box on your screen, type in your questions or comments, and Kristen will be monitoring that so we can address these throughout the session. Secondly, today's meeting will be recorded. Both the recording and slides will be posted to our YouTube channel, so you can revisit those, and it's also available to our members who weren't able to join today. And then finally, if we do have any connection issues, knock on wood that we don't, just go ahead and log back in and we should be plugging along. So a quick overview of today's agenda. You can see what that looks like. It is packed. This is our first all partner meeting, so we are going to give you everything. We'll start off, actually, I'll start off quickly with the welcome and general overview, and then we'll move on from there. All right. So first and foremost, welcome and thank you. Thank you for joining us for our very first all-member meeting. Thank you to those of you who have been coalition members for many years, as well as to those of you who are new friends, new members, who are just joining us. Since 2002, we've been working together, pooling resources and coordinating efforts to prevent cancer, increase access to care, and to reduce the burden of this disease in the many communities we serve. You, all of you, really are the coalition. You're the force of cancer control in our state, and we're truly honored with you. We're truly honored to collaborate with you all in this effort. I'm also on the agenda for NCC general updates, and honestly, there are many as we move into 2024. This meeting being one of our updates, and you'll hear more about them along the way as we go. Many of these updates and new things that you'll hear about were recommended by you, our members. So with that, I'd like to first introduce you to our updated 2024 Board of Directors. A special thank you goes out to these amazing folks as they provide oversight and guidance to the coalition. And as we begin the important work on the next 5-year Nevada Cancer Plan, our board also serves as the steering committee for this effort. As you can see, our board members hail from across the state, representing various aspects of cancer control and advocacy. Our board positions are for a 2-year term, and we wanted you all to keep that in mind if you're interested in perhaps joining us in the future. So we will look for people interested in joining our 2025 board in October, November. You'll also today get to meet our coalition staff. There are 8 of us, and I have to say, we have a fabulous team. I might be a little biased, but I think we rock. So to finish up a few updates, really, these are the themes from our membership and our strategic planning efforts as we move into 2024. They're not necessarily new, but might have a new twist on them. So really member involvement, connecting our members not only with each other, but with our coalition work. Thus today's all-member meeting. We've also created a new member orientation. So when partners join the coalition, they can see there are ways to get involved, learn more about coalition work and what's happening across the state. Diversity, equity, and inclusion. We've been doing a lot of work on this in the last couple years. So with research and input from our underserved populations that we've gleaned in these years, we're now better able to focus our coalition efforts for those most disproportionately affected by cancer. So we're really excited about that. You'll hear a lot about efforts that are happening within our collaboratives, focusing on specific communities. Education and outreach, we added a new position. We're really excited. You'll meet Sarah, our community engagement manager. You'll also hear more about educational opportunities that we're expanding this year, including our new inflatable additions, Larry and Lola, the inflatable lungs. Those are for community education. And finally, as we have been in the past, the work of the coalition is always very research-based, evidence-based. So evidence-based strategies that have been proven to be successful is typically what we like to replicate here, or we're working, providing our own primary research in many areas. We're excited about some opportunities to do more of that this year. So with that, you'll hear more about our updates in the slides ahead. I'm going to go ahead and turn it over to Kristen so she can share your member survey results. Thank you.
Thanks, Carrie. I'm gonna try and advance this slide. Okay, so I'm Kristen. I'm the communications director, and each year I help put together the member survey, which hopefully you completed. We actually had a phenomenal turnout this year. The state challenged us to increase our engagement on that, and we more than doubled the number of people who responded to that survey, which helps us a lot in determining what we need to be doing, what direction we need to be going. So I just wanted to share some of the details of that survey with you because we've never really done that before. We collect that information and review it, but we've never shared it out. So this is just kind of a word cloud of who all of our members are. A lot of you are working in public health. A lot of you are clinical staff, you're nurses, medical assistants, you're working in administration, you're physicians. We've got people who are, working in epidemiology or pharma industry, advocacy. We have volunteers. We have people working in marketing. We have teachers. Retirees. So it's a huge, huge group of people that are a part of the coalition. And our job really is to bring you all together. So one of the things that we look at when bringing people together are what are our member priorities. And so we wanted you to be able to see, what everyone is working on, what their priorities are, and kind of where you align with that. So early detection and screening, our early detection and screening groups are really a large part of what we do. So it's not surprising that more than 70% of our partners are working in that area. Access to care is a huge, huge issue. Resources and support, that's not surprising either because we have the Oncology Navigation Network and so many people engaged with that. Prevention is a big deal. And patient navigation. But really, we have partners involved in a number of the priorities that we're focused on, but this helps us kind of channel our focus a little bit and know, what you're looking to get in working with us. So we also asked our members what activities they would like to see more of and what activities they would like to see maybe that we could reduce. Or less of. And so this is just kind of a look. The blue here is, we're good with the level that you're doing. And the green is, please do more of this. You can see we have very little red, which is do less of this. So I think we only had 1 or 2 people say that we needed to do less of anything that we were doing. Overall lunch and learns, we got the highest number of people saying do more lunch and learns. So I'll talk a little bit more about that in a few minutes. We had more people requesting in-person meetings, which we used to have in-person meetings before the pandemic because we were not as Zoom competent, and the pandemic forced us to be Zoom competent. But it also has allowed us to really bring partners statewide into one online group together. So we are challenged with having in-person meetings just because of the geography of our state, but it is something that we're looking to do when we can. So this actually helped us to inform a little bit of our direction. We also had, what other efforts could you see us doing more of, and what other efforts you could see us doing less of. And as you can see, again, it's always more, it's very rarely less. And the less really is don't duplicate efforts, and kind of find some balance in working on other cancer sites. So be less focused on specific cancers. Some of the more items that people wanted to see more of, we are addressing. So when it comes to HPV, we are working on an HPV campaign that Lily will talk more about. Policy change at the legislature, Carrie is always focused on that. Printed materials, we're working on that. Rural outreach is a huge issue for us. As Carrie mentioned, we have new inflatable lungs, and we're working on additional work for lung screening. So all of these areas we take to heart, we're working on. There's only 8 of us. So moving forward, some of the changes that we're making based on the results that we received from the member survey is adjusting our collaboratives a little bit. So we noticed that our task forces and collaboratives have a bit of a cycle where we identify an opportunity or an activity or a program where we need to do some work and partner work and focus, and we build it up and we implement it and we get it going, and then we kind of we finish it and it's moving and it's going, and we hit a lull period, and then we kind of until we find our next project activity direction. And so in that cycle, we've found that a lot of the work happens in our collaboratives and a little bit less in some of our task forces. And so our prevention and early detection task force has become largely a report out meeting, and most of the work is done in those prevention and early detection collaboratives. So we decided to pause the prevention and early detection task force and focus on the collaboratives. So we have an HPV collaborative, and I'll get into those in just a minute. So we'll have a little bit of different focus on the meetings. We introduced a cell series that is short for Cancer Education Lunch and Learn. Those are the lunch and learns that everybody asked for. We've got some great topics I'll share. We are also planning an evidence academy. We know that our Nevada Cancer Control Summit cannot meet everyone's needs. We never tried to do that, but we want to meet more needs. So we are having, we're planning to do a half-day evidence academy, which is kind of a mini summit. It's going to be focused on one topic. And then we'll still have the summit. We've moved it to August 23rd and 24th. It's a Friday and Saturday. We've heard from lots of people that Tuesdays are problematic, Mondays are problematic. We're trying to work around and see what dates work best. So that's another opportunity. And then we have more outreach and networking opportunities. The photo here you see is one of the events that we put on in November for Lung Cancer Awareness Month. It was a paint and sip for the White Ribbon Project. And then we'll also be working more on the cancer plan. So our cancer plan is good through 2025. And we actually have to start working on it now just to get it done by the end of 2025 so we can launch it in 2026. So here's a look at our collaboratives. We have our HPV collaborative, which Lily is spearheading. It's brand new. I think the first meeting is coming up in February, and that's focused largely on engaging with rural providers to increase rural HPV vaccinations, but of course we want any youth to get vaccinated. We have our colorectal cancer collaborative that's spearheaded by George. That one is ramping up big time because we have Colorectal Cancer Awareness Month in March. Lily is leading the lung cancer collaborative. And you can see there a picture of our lungs. She's also leading the breast cancer collaborative. We have Amy on the survivorship task force. That is one task force that is still intact. And she also, Val leads the navigation network. And then Carrie is launching a surveillance and planning collaborative, and that is dealing with cancer data and information and cancer plan. So the cell series. These are a series of 45-minute lunch and learns. We're not offering CE on these, in part because many people have said we don't need CE. It adds a whole extra layer of expense and hoops to jump through for everyone. And we wanted these to be kind of quick bite, drop in, learn something, ask some questions, and move on. We had really great success with the breast cancer screening SB 330 Lunch and Learn we did last fall, and so we're basing it on a similar format. So these will be recorded and available on demand. So we'd love for you to attend and participate and ask questions. If you can't, you can still catch it on our YouTube channel afterwards. We've mapped out 8 topics for this year, all tied to our NCC work. So we start February 7th with a lung screening toolkit session. We have HPV vaccination for dental providers, biomarker testing, sun safety in May, sexual health for survivors, social determinants of health and cancer prevention, racism as a public health issue, and cancer in the environment. And those last 3 topics are actually all planned for the fall, and they are going to be covering topics that we see as cross-cutting issues in the cancer planning process. So we think that they're great timing to get everybody in those kind of thinking about those topics as they're working on the cancer plan with us. So as I mentioned, the Evidence Academy will be in April, and that's a half-day single topic learning opportunity. We are planning to have that focused on building a peer-to-peer network to increase breast cancer screening, working with the ladies from B&A Entertainment in Southern Nevada. It's a fantastic group, and definitely watch for information on that opportunity coming soon. And then, as I mentioned, the Cancer Control Summit is in August. It's going to be multi-track, each track with a specific focus. So hopefully you don't have FOMO on what you're missing in the other room. Hopefully we'll have some workshops, networking and awards reception, and then clinical presentations Saturday for our physicians who have a hard time taking off weekdays. So cancer plan planning is also coming up. That is going to include, we're going to launch it with a survey on the priorities and the goals and objectives coming up this spring. So watch for that in your inbox. Then we'll have our initial work session using the responses of those surveys during the summit. So hopefully you can attend and participate in that. As I mentioned, the CEL series will cover the cross-cutting issues, and then we'll work on objectives and activities with our collaborative members and hopefully get this out the door late next year in time for our summit in 2025. It's an exciting opportunity. If you are interested in working with us more closely on the cancer plan, please reach out to Carrie or myself. We spearhead the project, and we're happy to chat with you about it. And with that, I'm going to turn it over to Lily, who has our updates in prevention and early detection.
Hey, thank you so much, Kristen. So one of the very few things on that graph that Kristen showed with the red, the bar graph that showed red, do less of this, and green, do more of this, was meetings, because we all have a ton of meetings. So we have kind of revamped what was previously the Prevention and Early Detection Task Force into this meeting, which will serve as kind of our report out, what's going on with the coalition, where are your opportunities to join us in the work, and we're really focusing the work on the collaboratives. So you saw an overview of the collaboratives earlier. The SunSmart Schools, our skin cancer prevention program, is not a collaborative. It is a conglomeration of many different wonderful partners that we reach out for technical assistance as we implement the SunSmart Schools and SunSmart Communities program. So we did host a town hall to learn a little bit more about what direction our community wants to see our SunSmart program go in. And this is kind of what we found and what we'll continue. So we're going to we're still working with sunscreen and sunscreen access, but we're also expanding the focus to focus on shade. So we were able in the last year to help plant trees at one elementary school, and we were able to purchase 4 shade structures at 4 Elko schools. I am continuing to seek funds, write grants, and do what I can to keep those efforts going. And we're certainly going to move forward with advocacy and seeking resources to support more shade options, more on a policy level. We're also going to continue support to schools and communities. So we had a great success some years ago in passing a law that in NRS now, every school district must have a sun safety policy. But then we found that many of the boots on the ground in the schools didn't know about that policy. So we're developing and distributing a sun safety toolkit to help those boots on the ground in the schools. We're continuing our assemblies and class presentations. This is George and Val doing a fantastic sun safety, sun smart presentation with a bunch of kiddos. We're going to look at expanding to community pools, resorts, ski resorts. Where can we be having these conversations, especially so it's not just in the summer? We're doing more environmental assessments, especially around that shade work. And we're looking at having some fun for skin cancer awareness this month. We are also extremely excited to announce the release of the HPV cancer-free Nevada effort. The HPV-free, oh, I messed up the, just now noticing that I put in the URL wrong. We can put the correct URL in the chat. It's hpvcancerfreenv.org, and that website just went live this week. We are so happy for all of our partners who helped advise us on the creation of those tools. It has been wonderful. You see here a picture of the dental toolkit to help dentists talk about HPV, talk about head and neck cancer. Head and neck cancer is becoming more common than HPV-related cervical cancer. So we're really glad to introduce this partnership. We also have provider toolkits that we will be distributing door to door. Kristen referenced our cell series for dentists, and thank you very much for putting the correct URL in the chat. And we're looking at really doing some promotions, media promotion during Adolescent Immunization Action Week and Head and Neck Cancer Awareness Month. Really excited to be back in this sphere of HPV control and vaccination. We also continue to support tobacco control efforts. Tobacco continues to be the #1 cause behind most cancers, so working in that. We continue to support and collaborate with the Nevada Tobacco Control and Smoke-Free Coalition. If you're interested in that coalition and their fantastic statewide efforts, the URL is right there. We continue our work in smoke-free trucking meadows and smoke-free workplaces to create smoke-free environments, especially in those outstanding bars and casinos. Really happy that a number of the up-and-coming bars are electing to go smoke-free. It's just a really exciting change to see. We've got a huge retailer education project that we are working with our tobacco prevention on. Also an exciting opportunity. And looking for support for youth vaping education and control. We've managed to continue limping the Behind the Haze and Let's Talk Vaping campaigns along after losing the dedicated youth vaping fund. It was not reallocated during the last legislative session. So opportunity, we're going to be working heavily on reestablishing that youth vaping campaign. If you haven't seen the Behind the Haze campaign, it's because it's not for you. It is extremely targeted to teenagers. There's been this conversation that, well, we need a campaign. There is a campaign. It's fantastic. It's evidence-based. They've done great work here in Nevada. And you can look it up anytime. We'd be glad to point you in the right direction. We also have the Lung Cancer Collaborative. We have already done some fantastic work with this. This is the newest of our HPV is the newest of our collaboratives. This is the second newest. We were able to develop a Nevada-focused lung cancer screening toolkit that really speaks to the challenges in our culture and our, being a rural frontier, Western decentralized state. So really thankful to our partners who helped us with that. And we are working on the distribution of that. That toolkit also expands into providing technical assistance for lung screening programs. We can connect anybody that's looking at starting a lung screening program to experts that can help them. I will do a call out here. We are doing an assessment of care coordination. What happens when somebody is screened for lung cancer has a positive screening and needs to be referred to a specialist. We have heard from many of our partners that the time from that positive screening and actually accessing specialty care is way too long. It's 90 days, it's more than 90 days, it's way too long. So we are trying to learn what's going on there. We're trying to learn what is successful. What are those facilities that have, super fast turnaround times in that care coordination? What are you doing that we can then take to the rest of the community to help with this? But we are having a tough time because we need points of contact for these interviews. We've been cold calling a lot of places. We've been contacting a number of our partners. You have all seen the healthcare turnaround, shifting of positions. And so it's hard to find the right point of contact. If you think your organization should take this care coordination assessment and participate in this interview, put that contact in the chat now, please. We would really appreciate that. Kristen also referenced the Cell Series webinar on February 7th with Dr. Jamie Stutz, showcasing the toolkit, talking about lung screening, talking about the upcoming HEDIS measure. We are really excited for that opportunity, and it seems to be very well received before we've even done it. So we're excited about that. And then we're going to be expanding our efforts in Lung Cancer Awareness Month as well. Here's a great picture of, I think this one is Colleen. But as you know, we have Colin and Colleen, our giant inflatable educational colons. Again, we are doing another assessment around clinical barriers to colorectal cancer screening. We're having these same challenges with the right points of contact. So I'll just do the same ask. If your organization can participate in an interview, very quick interview, no more than 10 minutes, George will call you, Val will call you, I will call you. Please put that point of contact in the chat now, or in the Q&A probably. We are expanding access to screening options. The Choice campaign, knowing that more screening options increases the likelihood of an individual getting screened through any one of those options. And it increases, the presence of the at-home kits increases the likelihood that somebody will actually go get a colonoscopy. So we continue to work on that. It's been a challenge that Nevada Medicaid does not currently fund Cologuard. It is a non-reimbursable CPT, a $0 CPT. So we have been working on that for some time, and really appreciate all the partners that continue to sign on letters and help us in that effort. We will have plenty of training, education, outreach opportunities, planning for Colorectal Cancer Awareness Month. We have some really exciting events. So keep an eye out on our social media and our events calendar for us to announce those. Our Breast Cancer Collaborative is not currently meeting live. There is a quarterly newsletter. And we are working with many different partners, providing technical assistance, providing resources, working with them on messaging to support higher risk, hard to reach, hardly reached communities. We've had some fantastic successes in this area, one being the partnership with B&A Entertainment. That's Cheryl Ballard here in the picture, their executive director. They do peer-to-peer outreach and faith-based outreach to their community about breast cancer awareness, and we've been really glad to support those efforts and partner with them. Some other successes we've had: Senate Bill 330 passed during the last legislative session, which expanded access to supplemental screening by having all supplemental screenings for breast cancer covered. Super awesome win. We also had a mammogram party in the South, learned a lot of lessons, looking forward to replicating that in more communities this October. We already have an event scheduled. It's going to be amazing. where the mammography van from Utah is going to come to Utah Wendover. And the mammo van from Nevada Health Centers is going to go to Nevada Wendover. And they will be facing off across the border, providing screenings to both of those communities. I'm so excited for that opportunity. And then we also had a mammogram match that was very well supported. Really appreciated all the partner efforts on that as well. We are looking to host an Evidence Academy in April. Kristen already referenced that. It'll be roughly 3 parts. One, what's the research on the effectiveness of peer-to-peer programs for cancer screening? And then we're going to have our wonderful partners at BNA Entertainment come tell us what that looks like in practice. And then there will be an opportunity for anybody in our community statewide to talk about, well, what if we wanted to start a peer-to-peer program? How can we do that? Can we get technical assistance? And of course, we'll continue our branded Paint Nevada Pink in October, and it'll be bigger and better than ever. And I will turn it over to Amy to talk about the survivorship and navigation updates. Thank you so much.
Thank you, everyone. My name is Amy, Cancer Survivorship Programs Manager. I'm sure I know most of you, but just in case. And I'm happy to share some survivorship and navigation updates with you today. Thanks, Kristen. So in the cancer survivorship realm, we have been working on keeping our Thrive NV website. Kristen does an amazing job with all of that, but keeping that updated, and specifically over the past several months, we've worked on updating and curating resources on the Thrive NV website, specifically to include resources for those who have completed treatment. And we've made some changes on the website to reflect community groups. So it's a little more inclusive than just naming it support groups. So if you haven't visited that website, we invite you to do so. That is our website that is dedicated to all things Thrive NV, allowing people access to patient navigation, seeing what community groups there are around, and the opportunity to provide survivor stories and just see how they can get involved in that community. Next, members of our survivorship task force and NCC staff were lucky to participate in a few different podcasts on Test Those Breasts, which is a podcast from Jamie Vaughn, who is one of our lovely survivors and NCC members. And so I will drop that in the chat afterwards just to share these with you. We, as I said, NCC staff, Carrie was featured on one. Kristen and I were able to be on another and share more about the work within SB 330 and Thrive NV. And then we have some members from our task force. We have Natalie sharing about survivorship, specifically around Cancer Community Clubhouse and her experience, and also on palliative care, which continues to be one of those things that is very misunderstood. And we are trying to help other partners and experts in that realm to help get that word out, because it is such an important topic for everyone to know about. So we really hope that you will listen to those podcasts and share them within your organization, and even with survivors and caregivers that can benefit from hearing those. Survivorship task force. So as we all mentioned, we're shifting some things around and trying to make the most out of all of our meeting time and efforts. Within our survivorship task force, we are continuing to wrap up on something that we were working on before, which is working with expert partners to create some short social media videos. And that's again to help kind of demystify everything about palliative care. People can know what palliative care is, the differences between that and hospice. And really the point is so that people can have access to that proactive symptom management, which is so important for cancer patients and often a very overlooked part of their care. So again, we've kind of taken that on within the task force to help our partners across the state spread the word. We will be working on more rural and bilingual marketing. So focusing on helping people know about our Thrive NV community-based program, encouraging them to access resources through the use of a navigator, and also to reach out to us if they are needing assistance with connecting to cancer screenings. You can see from everything that we've shared so far that early detection, connecting people to resources is all incredibly important. And that's where those of us on the survivorship team try to take all of that together through our navigation and outreach efforts and try to connect folks to those resources where needed. And then cell series, we're all really excited about that. I'll just reiterate that we will have a few survivorship specific topics within the cell series. March is going to be understanding the role of biomarkers and personalized healthcare for cancer. And then we are hoping to have 2 in June, one navigating intimacy after cancer and one specifically on nutrition. So we are really looking forward to having this proactive approach for education. Again, hearing from all of you with what was important. And the next survivorship task force is going to be on February 15th. And we are going to discuss trying to recruit folks who are interested in providing their expertise for our upcoming cancer plan, because that's how we all, create that roadmap for the wonderful work that everyone is doing across the state. And we need input from those of you in the survivorship and navigation space. We'll also talk about Survivorship Month activities and kind of really discuss what the future of the task force, this specific task force, looks like moving forward, and see if we need to ebb and flow those meeting dates to adjust to what projects are happening within the state. So we hope that you can join us. And then again, June is Cancer Survivor Month. So we want to hear from you and join us in that meeting to start talking about that and figure out what activities are happening across the state for survivors. And then we're going to switch over to navigation. So we continue to have our statewide community-based patient navigation program that will be 4 years in a few months, which is kind of amazing to think about that. We designed this program to fill gaps and to work with other community partners across the state to connect folks to resources who wouldn't otherwise have the ability to connect to those. So we try to help survivors and caregivers who are being treated in Nevada with getting connection to any resources that they need during their cancer continuum. And we also do focus, as I've mentioned already, on helping people get connected to screening. So please keep that in mind if you're needing to reach out to us to help folks in that realm. We do have 3 of us on our team. We have Val and George, who are pictured here. They are bilingual navigators. They live in Southern Nevada. And then you have me up here in the north. And the 3 of us try to help folks when they give us a call through Thrive NV, getting them connected to resources. And we don't do that alone. We do that through obviously a lot of networking and collaboration. And we like to be a resource for statewide partners. And we also will reach out to you when we don't have the answers either, because that's how we all learn. And with that, the Oncology Patient Navigation Network is another really important piece of our Thrive NV program. This was created as a direct result of knowing that navigators across the state needed a place to come together so we can connect with each other, share resources. We're just stronger together. We're all trying to, to connect people to resources that they need. We are now an Academy of Oncology Nurse and Patient Navigator, which is what AONN Plus stands for, a local navigator network, which just means that we have that additional kind of national guidance, if you will, and leadership, which allows more networking opportunities and education to trickle down to our network, which we hope will just help the navigators that are part of this. And we encourage anyone who is working in this realm to connect patients and their caregivers dealing with cancer. If you work in that realm and you're not already a part of our navigation network, we invite you to become a part of it. We meet every other month, but we realize not everyone can meet regularly, but we still provide the recaps with a lot of resources, and we're always available to you if you have questions, looking for resources for the people that you serve. So you can join us to share about resources. You can present at an upcoming meeting if you know about a new resource that other navigators need to know about. We really need to know these things. Again, sharing information is how we can all do better at connecting people to the resources, which again was a big theme that we heard from the member survey. So this is one of those ways that we can do that. And we're always looking to collaborate to increase access to screenings and resources for all. Any questions on that, you can reach out to myself or Val, and we'd be happy to talk you through it. Thank you. I'm going to switch it over to Sarah.
Thank you, Amy. So hi, everyone. My name is Sarah Grocky, and I'm the newest member to the NCC team. I was brought on to coordinate efforts in outreach, community engagement, and then to create a volunteer program. We do have some exciting news. We are introducing a brand new volunteer management software called Volgistics. And it will be fully integrated into our NCC website. You can find this on our website under the volunteer tab, and it will include volunteer application, a link to a volunteer portal, which we're very excited about, which you can use for signing up for volunteer opportunities, tracking hours served, and receive messages. Another great feature of this volunteer management software is I'll have the ability to send out text messages and emails and different correspondence to volunteers in real time, so communication will be enhanced. We are looking at mid-February for this to be fully integrated into our website. So please keep an eye on our website come mid-February. And then in the meantime, please feel free to reach out to me. My contact information is here. It's sarah@nevadacancercoalition.org. So some of the big awareness months that we are focusing on within the next year: January for cervical cancer awareness, March for colorectal cancer awareness, April for head and neck cancer awareness, May for skin cancer, June for National Cancer Survivor Month, and October for breast cancer, November for lung cancer. So this list just includes the cancer awareness months that we're focusing on for outreach. There are other awareness months we know that other organizations are focusing on, and we really want them to take the lead on that, such as Childhood Cancer Awareness Month. And for the months that we don't highlight with outreach, we'll still be featuring them with some materials and some education on our social media as well. So some of the events that we have coming up, we're really excited to really be building this out. January, yesterday, 2 of our team members down in Las Vegas attended the Welcome to Las Vegas sign lighting for cervical cancer awareness. It was lit up teal. For February, we are looking at attending community resource fairs and rural outreach clinics. In March, we are planning a Northern Nevada rural outreach road trip. And we are attending rural health fairs such as the Elko Health Fair. We are working with some partners on CRC events in March for Colorectal Cancer Awareness Month, including Digestive Health Associates up here who want us to attend the Leprechaun Run, and then a CRC event down in Las Vegas with Sunrise Hospital. In April, we are planning to do a Southern Nevada rural outreach road trip where we start in Las Vegas and then head up to Tonopah. We are attending ACES Education Days. Those are the education days that the Reno ACES partner with the school districts to have the kids come out for a day. So we will be attending 3 of those, 1 in April and then 2 in May. We are attending the Get Your Rear in Gear 5K, which is a colorectal cancer awareness 5K event. In May, we are partnering with Skin Cancer and Dermatology Institute and the UNR Med Group to host a skin check clinic for Skin Cancer Awareness Month. And then, like I said, we are attending 2 of the ACES Education Days in that month. In June, we are looking to attend some Juneteenth celebrations and possibly looking at some rural county fairs in that month, and partnering with some of our survivor groups to host a survivor event. And I'll be working with Amy on that. In July, we are looking at attending Northern Nevada Pride again. That was really, there was really good reception when we attended last year. So we are excited to attend again this year. And we've got some community resource fairs that we will be attending. And then in August, we've got some more community resource fairs. September, we've got Fiesta on Wells, which is a Hispanic festival up here in the north. We've got more community resource fairs, and then we're looking at attending Dayton Valley Days. And then in October, of course, as always, that's our busiest month. We are planning, we've got some stuff in the works for Paint Nevada Pink, such as lighting the Reno Arch again, and possibly lighting the Las Vegas sign pink for breast cancer awareness. We will be attending the Las Vegas Pride, and then we are looking at the Virginia City Outhouse races. And then in November, this last year, we partnered with White Ribbon Project for a paint and sip party, and it was really well received. So we will be expanding our efforts in that and partnering with them again this year for another White Ribbon Project event. And then a tobacco lunch and learn with our tribal partners. And as always, if you have any outreach events that you would like us to attend, please email me at sarah@nevadacancercoalition.org. And then, as a couple of my colleagues have mentioned, we do have these large inflatable colons. We're always happy to bring them out to your awareness events or your events in the community. If you could please just contact me at sarah@nevadacancercoalition.org, or you can submit a request on our website as well. And so these are all really exciting new things that we're exploring. We've got a lot of stuff in the works on the calendar. And with the volunteer management program up and running, we will really need some help in that department. So please keep your eyes on the updates on that. And that should be about mid-February. So we are very excited. And with that, I will give it back over to Carrie.
All right, there's a lot happening, And I see there might be some questions and comments coming up. So please do take a moment if you have questions. If you have an announcement for your organization you'd like to list in there, please go ahead and do so. So what you've seen is a little bit about the revised structure for the coalition, and you've heard about these collaboratives, and that's you. That is all of you, and that's really where this work gets done. As Kristen said, there's 8 of us. We're not the ones doing all this. It really is led by our collaboratives, your ideas, your collaboration, your partnership. So if there's a collaborative you're interested in joining and working with us on, please do so and reach out. Are there any comments or announcements, Kristen, that you've seen?
I have not, and I see people raising their hands. I do not see where I can answer who's raising their hands. So if you do have something to add, please add it to the webinar chat or the Q&A. I enabled the webinar chat, so you should be able to type anything there. Yeah, we're really just here to share more about what we're doing and see if anyone else would like to share what they're doing. That would be fantastic. We have the time here.
Oh, thank you for the thank you, Jamie. And thank you. We couldn't do a lot of our survivorship work without your input and your dedication.
George, it looks like Nelson Velasquez can be a good contact for you for colorectal at Digestive Health Associates.
Oh, yeah. We're excited as well. And believe it or not, the inflatables, we are implementing some of our own research on the lung inflatables, but the inflatables are actually evidence-based tools to education and increasing screening rates, definitely in the colorectal cancer realm in other states. So there's actually research out there that says, yes, these are excellent tools. So if you would like one, if you'd like to learn how to use them, just let us know. We've had the colons for a number of years now, and it's just been such an amazing experience. We were very grateful to the folks who sponsored the purchase of those. And again, they're available. It doesn't cost anything, and they're fantastic. They're very eye-opening. We get a lot of people just coming to our tables at events to talk to us because they saw this weird looking big lungs, I should say.
And I'm not sure if Lily mentioned it, but there is research behind the colons as an educational event at outreach events. However, we had a difficult time finding any similar research for inflatable lungs. And so our plan is to actually do research similar to what was done for the inflatable colons to demonstrate the effectiveness of those inflatable lungs at outreach events. But I'm pretty sure that Valerie and George and Amy and Lily and Sarah can all attest to the lungs' power of attracting people from across a large event. I'm not seeing many other questions. Does anybody have any other announcements that they'd like to share? We can drop those in the chat, or otherwise we can give everyone back a little bit of time in their day. And if you think of anything else after the fact, our emails are all just our first name at nevadacancercoalition.org. You can find them all on our website on the staff and board page. Otherwise, I think we really appreciate everyone joining us for this first all-member meeting. We came up with it in December and thought that it would be just a great opportunity to touch base with our members and our partners and let you know what we're doing, and give you a little bit of exposure to things that maybe you haven't heard about because you participate in one particular collaborative and not in others. So thank you all for joining us. We really appreciate it. And again, we'll post this up to YouTube. So if you want to share with any of your colleagues to let them know what you're involved in with the coalition, it'll be available for that.
And Kristen will be holding another all membership meeting later in the year.
Yes, we are planning our second all membership meeting for June. We have yet to set that date. Oh, one other thing, we do have our new member orientations. So if any of this was completely foreign to you and you're still left with questions, or whether you're a new member or not, those orientations are going to be held quarterly. So the first one is February 1st. It's on our event calendar. Yeah, it'll be there. So what I will do is make sure that I've got a question here, the YouTube channel. Is that a question about NCC's YouTube channel?
No, it was just Jamie mentioned that the podcast episodes can be seen on video in the YouTube channel. So I was just asking her if she could
Oh.
pop that YouTube channel into the chat.
Yes, the Test Those Breasts YouTube channel.
Yep, it is fantastic.
Yes. All right. Well, thank you everybody so much. We really appreciate it. And we'll see you in our next meeting, whatever that winds up being for you. Thank you.
Here. Thank you.